Hi, this is Dr. Kwun from GP Out of Hours.
Welcome to this video. Today I booked to work in GP Out of Hours. I book a session of 5 hours. GP Out of Hours is a service patients can access when the GP surgeries are closed. If you'd like to join me, be sure to watch this video till the end. If you've not already subscribed to this channel, don't forget to subscribe and ring the bell so you're notified first each time I release a new video. This is my consultation room for the day. It takes me several minutes to log on the IT system. Patients are directed to GP Out of Hours service after an initial assessment by the 111 service. In GP Out of Hours, a variety of services are provided such as self-care advice, center-based appointment and home visits. The cases consist of acute medical events and unscheduled care. Common cases include asthma, abdominal pain, headache, symptom control in palliative care, suicidal ideation, febrile child, rash and sore throat. Telephone triage is a recognized system used around the world. Telephone triage has become an essential part of delivery of healthcare in the NHS. The term triage is a French word that literally means to sieve. Modern medical triage was invented by French surgeon Dominique Jean Larrey during the Napoleonic Wars. Larrey developed triage station on the battlefield to sieve wounded soldiers according to the severity of the injuries and the urgency for medical care. Similarly, in GP Out of Hours, patients requiring urgent callback are prioritized. At the start of my shift, there were 8 patients who needed to be called back. The workload is shared among clinicians who work in different GP Out of Hours centers. I called my first patient and started the conversation by introducing myself. It is important to ensure the person is the correct patient and then we can start the consultation. Once I'm happy, I elicit a history of the presenting complaint. It is best to start with a couple of open questions followed by closed questions. With telephone consultation, there are no visual cues. However, it is easy and convenient for patient to use. It is essential to listen attentively to the patient. The clinician relies heavily on verbal information to assess a patient. Sometimes it is important to ask questions to clarify what the patient tells you. Many patients can be managed over telephone.
What we can do, and because he's had amoxicillin before and it has worked, we can give him a course of amoxicillin. Alright.
Sometimes telephone consultation may not be suitable to remotely assess patients, and a face-to-face assessment is required. Patients are given an appointment locally for a clinician to review physically. If a patient is housebound, a home visit can be arranged. Eliciting red flags in history taking is an important component of a clinical assessment to exclude serious differentials. For example, if you assess a patient with cough, it is important to establish the duration of the cough. Is it over 3 weeks? Is a patient coughing blood? Hemoptysis is a worrying symptom. Other red flags include fever, breathlessness, chest pain, hoarseness of voice, and weight loss. Sometimes the diagnosis may be uncertain. Safety netting is an effective strategy to manage diagnostic uncertainty and minimize risk of harm. Patients may not present with red flag signs and symptoms. The term safety netting was first introduced by Roger Neighbor in the inner consultation. Patient may present early in the illness and deteriorate later. By advising patient of particular symptoms to look out for, the latter know when to seek urgent medical attention should new symptoms develop or should new concerns arise. Managing medical uncertainty with limited information is one of the challenges of general practice. Each clinician will deal with diagnostic uncertainty differently. Self-awareness is key in recognizing and managing uncertainty in primary care. A clinician may have a higher tolerance for uncertainty in comparison to another clinician based on personal experience and risk profile. Let me give you a working example of a case. I spoke to a mother on the phone whose daughter complained of pain involving the little toe. The mother described swelling and redness of the toe for the last 2 days. She was worried the toe was infected. I decided to offer an appointment to see the patient face to face in order to reduce the uncertainty of telephone consultation. I felt it was best to assess the girl physically rather than over the phone from a third-party consultation. The mother was initially reluctant for her daughter to come down due to her anxiety for healthcare professionals. After explaining her the reason for the face-to-face review, she agreed to bring her daughter. It can be useful to formulate a provisional diagnosis and management plan before seeing the patient and compare your management after having seen the patient. This will give you an insight in your clinical judgment with diagnostic uncertainty. When I saw the girl and her mom, there was indeed a redness and swelling of the little toe. There was no bony tenderness and the range of movement was normal. The girl appeared to have localized soft tissue infection. It was reassuring to find the patient was systemically well. Having assessed the patient, I was confident the girl had a localized infection of the toe that could be treated with a course of oral antibiotic. I gave advice to the mother and safety net. The value of the face-to-face assessment enabled me to lay eyes on the toe and avoid missing something serious such as a septic arthritis, which requires admission to hospital. During this shift, I dealt with a variety of clinical problems such as dizziness, loin pain, suspected stoma infection, breathlessness, and abdominal pain. I'm going to wrap this video here. Thanks for joining me on my shift. I hope you found this video useful. If you enjoyed this video, I recommend you watch A Day in the Life of a Doctor during a night shift. This was when I was working in paediatrics during a 12-hour night shift. To watch that video, click the thumbnail on the right. Take care everybody. Bye bye.